Welcome to the Going North podcast, where you will be informed, encouraged, and empowered to embrace your dreams and advance in life through authorship. I'm your host, best-selling author of the book Stay the Course, and certified leadership trainer, Dom Brightman. Be sure to check out the goods and services from every guest, as well as the host himself, yours truly. Now let the fun begin. And today on the Highlight Reel Builder for Authors, known as GMP, the Great, Glorious, and Glamorous, it's the Going North podcast. I got to thank my buddy AS herself. That's right, Miss Abigail Sinclair, with all of the fabulosity, sparkles, and unicorns for today's guest right here. Because my goodness, this gentleman right here, a 20-plus year expert. You heard that right, folks. Over 20 years, 2 decades and counting. Expert in several healing modalities, and in addition to being a trained chiropractor and medical professional, he helps individuals in their healing and recovery journey. And one of the wonderful techniques that he employs is the blood flow restriction, the BFR. And this wonderful BFR has recently started finding its way into the sports performance world. And as an expert in this technique, he has many valuable insights to share. So let's give it up for the good doctor himself, Dr. Ed Cara. How you doing today, Ed?
Hey, I'm doing great. Thank you so much for having me.
Yes, indeed. Yes, indeed. The good doc is in, baby. The good doc is in. Yes, indeed. So my goodness, man, as you know, with all introductions, they're not allowed to be 50 and a half days long. So mind filling in any cavities I may have missed about you?
No, not too much. I'm down here in Dallas, Texas, just trying to help people move better, feel better, and look better. So we got a cool clinic called Body Lounge Park Cities that I have with my partner, and she does a lot of medical aesthetics. I do mostly musculoskeletal rehab using blood flow restriction training as one of my modalities to help people get stronger, more resilient. And yeah, that's about it. Just been working hard for 20 plus years, trying to learn. There's so much to learn. It's never ending. And I'm always trying to bring, new techniques to people to help them achieve their goals.
Oh, yeah, that's right. Achieving those goals, indeed. That's right, indeed. So my goodness, so with the wonderful practice and becoming a chiropractor, is that something that you always wanted to do, or was it like at the age of 13, you're like, no, one day I was going to be a rock star, but darn it, I wanted to break backs instead?
No, it's an interesting journey. I really started my medical career as a frontline medic in the Army, and working in the emergency department. I was working around all these really high level physicians, and I wanted to go to medical school. And the my seniors really kind of talked me out of it. They were really kind of disgruntled with how medicine was going, and this is a long time ago. This is probably close to 30 years ago now. And during that time, I was wrestling. I was a Division I wrestler in college, and I tore 3 out of the 4 ligaments in my knee.
Ooh.
And everybody told me I had to have surgery. There was no choice. Had to have surgery. The problem was if I had surgery, I was going to forfeit my senior year because they wouldn't let me clear for at least a year. And I got injured on December 30th, and that would have taken me pretty much all the way clear into my senior year, and I would have basically given me no chance to wrestle again. I couldn't live with that decision. So my neighbor, who was a chiropractor and my athletic trainer and my strength coach and my orthopedic, we all kind of put our heads together and we said, well, what's our best option? And we decided to give it a go to just see what we could do if we just tried to rehab it, just make the joint stronger by strengthening all the tissue around it. And because I could always have surgery, the surgery was not going to go away. I could have it if that failed. So I thought, it's an interesting approach. Nobody's really given me that option. So let's see what we can do. And in about 4.5 months, I was back on the mat with a big old brace and able to wrestle again. I thought, wow, this is pretty cool. Like, this is an alternative to what not only my training in the Army was, but I also grew up in a kind of a Western medicine. My mom was a really high level nurse. And it just made me think differently about what I wanted to do with my life and how I wanted to serve others. So I thought about doing what my team did for me. How could I do that for others? And so I worked as a strength and conditioning coach for a while, got my NACA certification, which is the highest certification strength and conditioning, still even to this day. I was kind of working, I did an internship in a physical therapy clinic, was kind of poking around, trying to figure out what I wanted to do if I wasn't going to go to medical school. And my neighbor, who was kind of helping me through the process, said, "Well, have you thought about going to chiropractic school?" And I really didn't know much about what chiropractors did or what their training was or really anything. And I started looking into it. I was like, wow, I can open my own practice. I can be an entrepreneur. I can help people that I want to. Have a liberal license. I wasn't really thinking that I wanted to do a lot of pharmaceutical and medical intervention anyway. I kind of want to be an alternative. I already had the prerequisites because I had the prerequisites pretty much done for medical school. So I enrolled myself into chiropractic school. And that was, gosh, close to 30 years ago. And I've been in practice for 22 years since. And, I have a really diverse background. I'm a strength and conditioning coach. I was a Army combat medic. I'm an athletic trainer. So I've worked sidelines for professional and universities and high schools and adolescent clubs. And I kind of mix all those things together. So I don't really identify with one unique, I guess, profession. I don't call myself a strength coach. I don't call myself an athletic trainer. I don't call myself a chiropractor. I'm just Ed. I just try to put as much knowledge as I have and experience as I have into each individual patient that I have and treat them individually, whatever that modality or technique or philosophy might be that best meets that person. Because everybody responds differently to different things. Some people respond great to manipulation. Some people respond great to acupuncture. Some people respond great to a combination of things. But in my opinion, all people respond to exercise and getting stronger and getting more resilient. So that's kind of my foundation, that everybody gets exercise and improves their capacity for what their body and their life puts on them as far as demands. And then I use these other techniques to help people get out of pain and move better. So it's kind of a unique approach,
Yes, indeed. Yes, indeed. That's what I'm talking about, indeed. So, my goodness. Army medic, man. How many years in service, my man?
8 years.
Woohoo! That's what I'm talking about, indeed. Thanks for 8 years of service, my man. Appreciate you.
Yes, sir. My pleasure.
Yes, indeed. Yes, indeed. Always got to highlight the vets, especially when they list how many years, because that's definitely good. Because some folks don't even make it to basic training or through, but my man made it through and beyond, baby. 8 magical years, indeed, and now helping the masses and the molasses, indeed. And that's kind of like impressive story, my man. Like that's the power of really having the right people around you, like really tearing 3 out of 4 ligaments in your freaking knee like that, and then being able to really get back on the mat 4 months later with the combination of just all those things you mentioned. Like that's really one heck of a feat.
Yeah, well, I had a great team around me. I mean, I think that's I think more and more we all need to realize that we need a tribe. Like we kind of kid around with the kids, like, man, it takes a tribe to raise these kids, but really it takes a tribe to raise all of us. I mean, you think about all the people that are in our lives and that help influence us, and the people that really have trouble that don't have those people. So I've been really fortunate to have great parents, and my partner now is amazing, and great friends, and really great people to look upon, that whether it's been looking at and growing the business or looking at being a better provider or just being a better man, just having people around you that can help pull you up. And then hopefully someday, be able to provide that for other people that are looking for guidance. I think we need to search out more people that, can inspire us and make us better, and surround us, not be the smartest guy in the room, be the person that's looking up to be that smartest guy. And it helps us grow and helps us live a fulfilled life.
Yes, indeed. Yes, indeed. So my goodness. So with all those wonderful years in the magical business, like what led you to finally write and publish this wonderful book, like your wonderful approach to the flow restriction? Heck, maybe even before the book, maybe even mentioning like what is blood flow restriction training for those who may not be familiar with it yet.
Yeah, sure. It's what I was taught in school was that you had to tear down muscle in order to build it back up to get stronger or faster or bigger. And so that was always kind of the mindset. And in rehab, that can be really difficult because if you have a tissue that's already torn, like let's say somebody has a torn hamstring, you can't really stress that hamstring very much, right? It's torn. Like if you stress it too much, you make it more injured. So I always struggled in my rehabilitative practice of how do I give people enough exercise and enough resistance to actually build strength and muscle. And in addition, in order to build strength and muscle, it takes anywhere between 12 and 16 weeks. And that's consistent training. It's not like I go to the gym and I go to bench press and all of a sudden a week later, I've got these big pecs and, I can bench press 100 pounds more. It takes time and effort and energy and diligence and consistency. So it's a little frustrating when you're in practice and I might see somebody for, somebody might come in, they strain their calf or they strain their hamstring. I might see them for 6, 8 visits, probably max. I mean, either insurance runs out or they start feeling better. So they feel like they don't need me as much. They run out of time, they're traveling, something usually gets in the way. And I've nowhere near gotten to the point where I'm going to be increasing strength and hypertrophy. There's no way that somebody carries out 12 to 18 weeks with me under normal circumstances. And so it was kind of frustrating as a provider, knowing being an exercise physiologist and knowing what it truly takes to cause muscle gains. I wasn't really meeting that. And most therapists really can't. We don't get the chance to. We can't stress tissue enough because the tissue is typically injured. So I would kind of have to work around that and just not get the outcomes that I was really, really looking for. You help people, you get people out of pain, which is definitely beneficial. But basically in the back of my mind, I knew I wasn't getting them to the point where they were able to tolerate what injured them in the first place. Because if they were strong enough to tolerate the forces that were being imposed on them, they would have never gotten injured in the first place. So I'm not sure if that makes sense or not, but it was always kind of a conundrum for me. And then in about 2015, my buddy, who was the director of sports medicine at FC Dallas, which is the Major League Soccer team here, he's like, "Hey, have you ever heard of this blood flow restriction training thing?" And I'm like, "No, I have no idea. What is that? It sounds kind of medieval, And he's like, it's an interesting technique. You use these cuffs and you inflate them to a certain pressure, which reduces the amount of blood flow into the limb, and your brain thinks and your body thinks that you're depriving it of oxygen. So the exercise is much harder, almost like if you're exercising to the point where you're depriving it of oxygen, and you start to get that burn much quicker than you do when you aren't depriving it of oxygen." And I'm like, "Huh, that's interesting." I'm like, is it dangerous?" And he's like, "No, look at the research." And so I kind of did this monster dive into the research, and my PhD is in sports medicine, and so it was like, everything I do is evidence-based. And so I'm doing this deep dive, just nerding out on how many studies showed its safety and BFR efficacy and validity. And what really turned me on to it was that what should take 12 to 16 weeks to gain strength and size of a muscle can be done in as early as 3 weeks using BFR. And I'm like, wow, I can do what would normally take up to 4 months in less than a month. I'm like, I've got to research this more. I got to start playing with this more, because this was like right up my alley. So I just started just deep dive into it, just studying it. And then I bought some like kind of some cheap cuffs off Amazon, and I started playing with it with myself. And then I'll never forget, I had this former Mr. Olympia was a patient of mine, and he had this tricep tendonitis, and he'd been struggling with it for about 6 months. I'd never seen him before. He was in for the first time. And he was telling me that he hasn't been able to lift as much weight. He was starting to lose muscle, or as known as atrophy of muscle. And, you know, you're a former Mr. Olympia, you're used to being these big yoked guys, and he wasn't happy with losing muscle mass. So I said, you know, Tom, let's try something. I want you to try this BFR thing. He was traveling, so I gave him my cuffs. I think I was traveling too, so it wasn't a big deal. I said, I want you to try this for 2 weeks. And when I get back, let's just reconvene and see how you do. So I gave him the protocols and I gave him some exercises to do. And in 2 weeks, when I got back, we remeasured his arm, and it had matched his non-injured arm. And it had been about a half-inch smaller than it was prior when I left. And it was just like, he was blown away. I was blown away. His strength felt like it was totally coming back. He wasn't having pain anymore in the tricep. And it was only like 2 weeks. I was like, wow, okay. So I know this is only N=1, but I'm seeing differences. I've got Tom seeing differences. I'm like, this is really cool stuff. So I just started continuing to do a deeper and deeper dive. And what I really realized, there wasn't good options for safe and effective cuffs in the marketplace. Like there were some products on Amazon, but there wasn't really a reasonable or affordable product. I mean, the cheapest product that was of high quality was like $6,000. I'm like, I'm not spending $6,000. I don't even really know how this all works. So I went to a guy that I was working with, and I was writing some education with for some other curriculum. And I'm like, you've got to check this out. Like, look at the studies. Anecdotally, I think this is great. And he decided that he wanted to start manufacturing evidence-based products to do BFR, but in an affordable way. And so we've been doing that now since about 2015. 2016 is about when we started trying to produce some affordable cuffs that are evidence-based and effective and safe. So yeah, that's how I kind of got into it, and I've been using them ever since, and just seeing amazing changes, helping people accelerate their rehab, and using it for a lot of different reasons. Using it for aerobic capacity, being able to put, you know, if I just go for a 20-minute walk, physiologically, my body doesn't have to adapt to that. I really don't gain much. It's healthy for you. You should not walk, but I'm not going to really see changes in my aerobic capacity. I'm not going to see changes in my VO2 max. But if you put cuffs on your lower legs and you go for a 20-minute walk, because you're reducing blood flow to the legs, you actually not only gain strength in your quadriceps and your knee, but you also increase your aerobic capacity. And you only have to do it 4 or 5 times a week in order to see those changes. Whereas if I was trying to do that normally, I'd have to train for 45 minutes to 60 minutes at a time at high intensities. And so you can not only increase strength and size of your muscles without having to lift very heavy weights, like very light weights actually, but you can also increase your aerobic capacity. And so I really wanted to take my 8 years of studying this stuff, 7 years of studying this stuff, and put it into a format, into a book where you didn't have to be a physical therapist or a PhD or a scientist or a doctor to read it and understand it. I wanted to make it, you know, kind of for just everybody, so anybody could enjoy it. Anybody could read it and understand it, what the concepts are, and then start to apply it yourself if you felt like that was something you wanted to do in your exercise journey.
Oh, yeah, that's what I'm talking about, indeed. That's what I'm talking about, indeed. And that's awesome, dude. Had a Mr. Olympia as a former Mr. Olympia as a client, dude. Like, that's freaking amazing. And you were just in the beginning stages of the whole restriction training when he was your client, right?
Yeah, right in the beginning, he was probably the first patient that I ever used BFR. I had used it on myself just so I understood what it felt like, and I understood kind of you always kind of try stuff on yourself as a clinician first before you go trying it on other people, because it's hard to explain to somebody what they're going to experience unless you know it. And so I had done it on myself, but he was my first patient that I actually used it on. Yeah. And I have
Awesome,
to admit, I
man.
kind of told him, like, listen, Tom, I don't really know what I'm doing here. Like, I'm looking at the research and I'm trying to apply the research into a clinical setting. Because really at that time, there wasn't a lot of options. Like, I was looking for classes to take, and there really just wasn't anything there that was, um, you know, reasonable and affordable. There was like one class that you could take, and it was like months and months and months away, or it was not located near where I was living. And so I was really trying to take the research and apply it on my own.
Nice. That's what I'm talking about, indeed. That's what I'm talking about, indeed. Definitely sounds powerful, indeed, especially since this actually worked for your 90-year-old father at the time, right?
Yeah, Dad. Yeah, well, he's 88, just about 90, and I mean, it's safe for him to use. He's able to do, just simple body weight exercises, and it helps him to maintain muscle mass and just be able to, continue to do activities that he wants to do. And so, I kid when people see my dad, he eats well and he doesn't drink, he doesn't smoke really, not, he doesn't smoke at all. He really doesn't drink too much. And he really watches his weight, and he's 88 and he looks like he's 68. So yeah, he enjoys using the cuffs to give him a little bit more of a pump, but and he really can't lift heavy weights because he's afraid he's going to hurt himself, but he's able to use body weight and light weights and still get um at least maintain muscle mass, if not gain muscle mass.
Nice. That's what I'm talking about, indeed. That's right. Extending the youth. That's what I'm talking about. That's what I'm talking about, indeed. Almost 90 at age of 88, feeling like and looking like 68. Heck yeah, man. That's what I'm talking about. That's right, indeed. That's right, indeed. Founding youth swag, indeed. So, my goodness, man, like with all of this wonderful knowledge, like what's next for you with the whole training, too? Is there going to be like a part two, or are you continuing to build upon this? Because I believe you got some courses on top of this, too, right?
Yeah, we do some live courses and live certifications for providers, and then we have online courses as well. You can find a list of all those at smarttoolsplus.com. And also we have the cuffs that I was talking about that I helped develop that are both affordable and safe, very user friendly. And we've got two different cuffs, one that's just made for consumers, that are very simple to use, one or two presses of a button and they automatically inflate and inflate to a safe and effective pressure. And then we also have ones that are designed for healthcare providers and strength and conditioning specialists. So we're on our third generations from 2016. We keep increasing the usability and effectiveness based on the research. So we keep modifying them, and next year we'll release our generation 4, which is what we're working on right now, which is it's an all app based cuff that'll inflate. You'll control it from your phone. You'll be able to set your parameters. You'll be able to record your exercises and kind of maintain your BFR journey all within your phone. So it'll be pretty cool. So we're working on that right now. That's what's coming up next. And then from an education standpoint, I've released my level 2 course, which is beyond rehabilitation. It's more for how to apply BFR for strength and conditioning. So how to apply it for aerobic training or cycling, how to use it before athletics for performance or after athletics for recovery, how how to use it swimming, and all different ways to use BFR outside of the rehabilitative process. Because up until now, most people have utilized BFR for rehab because you're using it for light loads. Tissue might be injured, so you can't lift heavy loads. But we saw during the Olympics this year that a lot of Olympians are using BFR because it reduces the amount of overall volume that you need to use and train with. So it reduces, the soreness and reduces the time that you can't train. It allows you to train more often without breaking down the tissue. Like bodybuilders like to do it a couple times a week because you still get that pump, you still get that strength and hypertrophy gain, but you don't have to hit the heavy weights, so their joints don't get as abused and there's not so much volume on the joints. So trying to open up BFR to just the athletes also, besides just the injured, is kind of like, it's kind of the next phase, really.
Heck yeah, man. Heck, the Baltimore the Baltimore Ravens could have used that last football season, man.
I'm sure there's plenty of guys on there using it.
Oh god, yeah, man. It's like, oh man, could have used some of that last year. My god, but yeah, man, definitely. And this sounds freaking amazing too, especially about the part about the joints too, because I know that's one of the major complaints I hear from folks as they age. It's like, hey, on the outside it looks good, but hey, then there's cousin Artie, and then there's, or some say Uncle Artie, and then of course for some were athletes back in the day, and then they let dad bod take over, or some chicks they like to go for mom bod, and it just goes down. They never really get back to at least a better form. They just stay in their current form. That may not be their ideal form indeed. So it sounds like a man's helping folks to regenerate, baby, and rejuvenate.
Yeah, absolutely. I mean, it's really, my opinion is that movement really prolongs our life. I mentioned my dad earlier, and just him exercising almost every day, and yeah, my mom too, really. I mean, they exercise together, and it's kept them young and healthy and being able to do the things that they want to do. And I think down the line, I'm 48, and if I ever retire, hopefully someday, I want to be able to enjoy the things that I'm working towards. And I've got to take care of my body now so that in 40 years that it will still be there for me. And so we can't let it squander. We've got to move every single day, and it doesn't have to be heavy weightlifting. You can do a combination of things. And BFR is just a small part of that. If you want to not have to lift heavy weights, but you still want to maintain or increase your strength or your muscle size, you can do it without having to overstress your tissue or risk injury, which I know a lot of older people are afraid of. They don't want to get injured. And so it's the key to staying healthy, and keeping your body moving.
That's right, indeed. Amen to that, indeed. That's right. Stay in motion, baby. That's right, indeed. Keep moving, indeed. Don't stop. Keep moving. That's right. That's right. Get it, get it. That's right. So, since you've been on a little bit of an interview tour and you got your own show, if I'm not mistaken, is there a question that you wish you'd be asked more often when you're on the guest side of the game on these podcasts?
I don't really think so. I think that people kind of get to kind of what drives me, and usually I'm able to kind of describe my background and how it's diverse and unique, and kind of what I'm about. I think I love doing these things because not many people really get to know the real me when they're in the clinic with me, because it's usually all about them. At least I try to make it all about them and not about me, because that's why they're there. So it's cool to just kind of get my story out, and because the more people that I can help, and the more people that kind of get to know me, and if it jives with what they're looking for, then I might be somebody that can help them. And so no, I really appreciate the opportunity to kind of share my story and why I'm so passionate about BFR, and why I think it's It's one of those modalities that's really here to stay for the long term, both in rehab and physical therapy, but also in fitness and in health.
That's what I'm talking about indeed. That's what I'm talking about indeed. Zach, a fun question I've been loving to drop on folks recently, and that is if your wonderful book, your approach to blood flow restriction training, if it was a food, what would it be and why?
What would it be and why? That's awesome. I would say that it would be an apple, because it's not going to take a long time to consume, but it's going to be good for you. You're going to enjoy it. And when you throw it away, it might just fertilize something else to help it grow.
Oh, yeah, that's right. The fertilizer indeed. That's right indeed. That's right indeed. So heard that right, folks. The doc produced an apple, y'all. That's right. So that means he kept himself away, y'all. So that way you can stay close to the content, y'all. That's right indeed. That's right indeed. That's right indeed. But don't worry, he's got an apple shield. So don't worry, the doc is here for you. Even if you have like 20 apples.
That's right.
Yes, indeed. Yes, indeed. Well, we're coming down to the magical question that every guest gets to receive, and that is if you're to wake up tomorrow and you're 25 again, but you're still in the year of 2022, with all of your knowledge and experience, what advice would you give to yourself?
Man, that's good. I would say enjoy the journey. Don't always look for the finish line. Stop a little bit, smell the roses, because we all live a wonderful life here in the United States. And sometimes we need to slow down a little bit and just enjoy it and appreciate what we got and thank God and give grace every day.
Yes, sir. Day, yes, sir, day, baby. That's right, indeed. That's right, indeed. Don't look for no finish line, indeed. There is no finish line. Go that distance, y'all. Go that distance and beyond, baby. That's right, indeed. That's right, indeed. And my man, Dr. Ed, right here, has got you covered like a blanket, so that way you not only go beyond, but also plus ultra indeed. So grab a copy of that blood flow restriction train and see if it can up your game in 2022 and beyond, y'all. It's good stuff indeed. And for those who want to keep up with all the wonderful things that you're doing and in the future, Dr. Ed, what's the best way for folks to do so?
I've got a website for BFR training. You can go to bfruniversity.com. And there I do a weekly podcast, or it's really more like a webinar, and I answer questions regarding BFR and I post them there. You can go on my YouTube channel, just under Ed Cara, EDLECARA, and I post my podcast there, and I also post exercises and other things as well. And then on social media, I'm under Ed Cara, EDLECARA, and I just kind of post whenever I get a chance, different things about different patients and different treatments, and try to give some tips and tricks on how to keep yourself moving and healthy.
Woohoo! That's right indeed. That's right indeed. Head over to my man's wonderful website indeed. The BFR University, baby. The dean has got you covered like Jimmy. Indeed, y'all. I'm telling you, check out his site. Check out all of his wonderful wares. We're going to put notes to that, or should I say links to that, in the show notes indeed. So check it out. See if it's up all of your alleys indeed. So any parting words before we close up shop, Dr. Ed?
No, I just want to say thank you so much for having me on. Let me share the story. And if anybody has any questions, just feel free to reach out. I'm happy to help.
Thanks a bunch for tuning in and setting aside some of your time to listen to this wonderful podcast, Going North. If you really enjoyed what you heard, do me a solid and share this with your network and someone that you care about that would get something out of it too.